Next, we're going to be moving to study skills. So there are a lot of resources and ideas and perspectives on there about how to study. And one of the things to think about is there are really good resources out there designed for nursing students. So keep in mind your faculty have put together a number of resources a lot of times. You have already paid for some resources as part of your program. There are optional office hours a lot of times that faculty will offer, deliberate practice, open lab time, study guides, blueprint. All of these are good resources that you can use that are designed for that specific course. So sometimes there's some resources that have nothing to do with your university or your class or that specific topic, but they're online and they may or may not be good, quote unquote, resources. So keep that critical eye in terms of if you've looked through your course to see, well, what extra resources are there, because I'm just not understanding this topic. Maybe there's no office hours available at the time you're available. Maybe the faculty's not available to meet with you. Maybe there's no peer tutors available. Maybe there's ATI resources aren't really helping you, and you start to resort to looking online. Keep in mind that there's a lot of stuff out there that may or may not be reliable. And so look at the sources, look at the content creator, think about, do they have your best interest at heart? And if you're seeing discrepancies, bring them up to your faculty. There are a number of practice questions available online. Some of them are really useful. Some of them are maybe not as useful. A lot of courses have practice questions built in. ATI has practice questions built in. Some of them online will be at a very basic level, so maybe more of what we call like a knowledge level question where you just need to know a definition or you just need to know what a concept means. But on the test, we've moved beyond that. We want to see how you apply that knowledge. We want to see how you analyze that knowledge. So keep in mind you want your practice questions to really bring your knowledge up to the level that it needs to be for that class. So another thing to think about with studying is to create small, achievable goals. So as I've mentioned in the past, you can have a lot of things on your plate. You can have multiple courses, multiple exams coming up, papers due, etc. It can be very overwhelming. So make some goals for yourself that are achievable and small. So rather than, I have to finish writing this paper today, maybe I'll say, in the next hour, I want to write one paragraph for my introduction. So take a small bite out of what you need to accomplish. And then, like the example says here, don't just study for my nursing fundamentals class, but I'm going to study the specific concept of pain and pain assessment. So give yourself targeted topics so that can keep your studying focused and also can make you, frankly, feel really good when you're done and say, okay, I did that thing, I achieved that goal, time to move on to the next. Looking at some more specific study skills here, this definitely falls in the category of take it or leave it. Think about what works for you and what you feel like you could do. One thing that works for students time and time again is to teach the content that you are trying to learn. So rather than looking over your notes quietly and thinking, yep, okay, that makes sense, I think I understand it, you can start there, but then once you've looked at your notes, let's say one page of notes, flip them over, don't look at them anymore, and teach them out loud. Teach a wall or a very patient and kind friend what you just read about. And that will really test your knowledge, and it will identify things that you thought you understood, but maybe you didn't, or things that you thought you remembered, but maybe you didn't. And if you find that, wow, when I reteach that one page of notes, I'm realizing I really don't know it as well as I thought, so I'm going to do it again. And this is another thing that you can do while you're moving. So while you're teaching the content that you're trying to learn, stand up, pace around, walk in a circle. That can help keep blood flow going and keep you engaged. And then reading notes out loud can also help. So I have a lot of students who, when they read their textbook, they say, I just can't focus. The chapters are really long, and I frankly don't do it because I lose interest and I get distracted. One thing you can try is reading the chapter out loud, or reading an article out loud, or even reading your notes out loud. By reading things out loud, and then you can actually record your reading, you are forcing yourself to read through something without taking a break and looking at your phone or getting distracted. And then if you have the recording available, now you can listen to it. Maybe you listen to it while you're walking to class, or maybe you listen to it before you go to bed at night and you're too tired to study, but you kind of want to passively listen to something. So you have that recording available, and you can hear your own voice teaching you what you need to be studying. So this can work for anything from textbooks to articles to class notes. In terms of study guides, there's a lot of different approaches to study guides. A lot of times what we will see is students make very, very long and complicated study guides. And they're really beautiful. Maybe they're color-coded. Maybe they are 60 pages long. But the students sometimes will tell us, well, I made it, but I only looked through it once or twice. And a study guide should be something that you look over many, many times and really focuses on the things that you don't know. So if you can identify for this specific topic for this class, maybe I need to focus on mobility. I'm going to just write the things from my study guide, using what's on my study guide, the things that I know that I don't know, and I'm going to write those on one page. And I'm going to maybe draw a picture or use different colors, for example. But don't write down the things that I already know, because it's just going to take up space. Really need to focus on what I don't know. So make it user-friendly, make it concise, and you can take your study guides and go back to doing that teach the content where you have that one page on mobility. I'm going to read it over, I'm going to put it face down, and I'm going to teach it out loud and see what I really truly remember. Now flashcards, some people swear by them, some people hate them, some people are somewhere in the middle, and some people are not sure. Flashcards can be great for just basic knowledge and definitions, but keep in mind that many of your nursing exams and definitely your nursing boards will not just be on your knowledge recall. So what's the definition of X? Or what is this for example? It's going to be how do you apply your knowledge of X in X situation. So if you're really struggling with definitions or just basic concepts, sure, flashcards are not going to cause you any harm, but make sure you're thinking about the next level. How do I really test my knowledge? So something you can do with that is to create something new. So you have your notes on, maybe you're looking at professionalism. And instead of just looking at these bullet points of a list of notes you have, maybe you make a drawing or a table or a diagram or a concept map. Or you just draw something that has all these interesting little quirks to it that remind you of the key things you need to understand. So when you create something new from your notes and from your knowledge, that really can help cement concepts in your brain. And then for things that are just rote memorization, for example, pharmacology is a great example with this one, where it's just drug names, side effects, indications for use, etc., and it just starts to be a lot of content. Coming up with creative ways to remember specific words and specific drugs, for example, can really help you retain information instead of assuming you're going to just memorize every drug name and everything about that drug. So one example here, you'll probably come up with one that's better. Metoprolol ends in lol. Lol sounds like a wall. If I walk into a wall, I slow down, and metoprolol actually can cause bradycardia, or it can cause your heart rate to drop and slow down. So maybe that's a way that I remember that specific side effect of metoprolol.